antenatal depression is simply depression that starts in pregnancy. The reason it's so important is that for a long time the focus was just postnatal depression. Now, postnatal depression is also important, and the rate is about, studies suggest, between 10 to 15% on average, but actually rates differ if you look at various studies around the world, but roughly 10 to 15%. Antenatal depression is slightly less, as seen in studies. It's probably around 7%. But the issue with depression antenatally is that you have a woman who's struggling with depression, and that has an impact on her, the family, but also on the developing fetus. And we know that biological, the impact on the fetus biologically, and in terms of the baby's own development in utero, in the womb, is really important. So it's very important to intervene and treat a depression antenatally because it has an impact on the developing baby. The other issue is that antenatal depression can often just carry on as depression into the postnatal period.
As we all know that the birth of the baby can trigger a lot of powerful emotions, which can range from joy, excitement to fear and anxiety. But sometimes it can be so unexpected, like depression. Most of the new moms can have some kind of postpartum blue, in which she can have, inability to connect with the baby, difficulty in sleeping, anxiety, sleepless nights. But usually it lasts for about 2 weeks. But if it persists for a longer time, and if the symptoms are more severe, that of depression, that means excessive crying, inability to sleep, inability to connect with the child, loss of weight, loss of appetite, and even suicidal tendency, then that is called postpartum depression. Family members are usually the first people to identify this, and it's very important to pick it up as early as possible so that it can be treated properly. If we talk about what are the causes, usually there are no known causes. It can be physical form, like inability to sleep at night, no proper diet, or it could be because of the loss of hormones. But yes, there are few risk factors for postpartum depression. The risk factors can be previous history of any depression, previous history of any kind of mental illness, family history of illness, family history of any mental disorders, or any physical problem, any physical health issues, inability to connect with the family members, problems with the spouse. All these are risk factors which can precipitate this postpartum blue or postpartum depression. So how do we treat it? As I said, the family members are the first people to identify it. So it's very important to talk to them together, to counsel the couple, counsel the family members. It's very important, we can ask them to connect to all other new moms, so as to identify what are the causes. If she gets a good sleep, good diet, exercise, meditation, massages, all these things will help her in this condition. But if it is not improving with this, or if it is becoming more severe, then it's important to connect with the psychiatrist so that proper psychotherapy and proper antidepressants can be started.